So today we're going to be talking about chronic rhinitis. And to kick off the show, there's some recent coverage news in terms of coverage. Can you talk to us a little bit about that?
This has been a very exciting time when it comes to the treatment of chronic rhinitis. So there was this procedure that came out for chronic rhinitis called a posterior nasal nerve ablation. And so many of the private insurances have considered it experimental for a long time, even though it was being covered by the public insurance, by both Medicare and Medicaid. However, Cigna is the first private insurance that has officially come out nationwide saying that they will start approving this procedure. And so it's been a huge gain in getting this procedure a bit more available to our patients.
Yeah, so you're potentially got numerous patients who now will be able to have this covered by their insurance.
Yeah, exactly. This has always been the most frustrating part, right? Because there's been a lot of patients who wanted the procedure, who probably needed it, but their insurance just wasn't covering it, or they were denying it, saying that it's experimental. So to be able to give access to those patients is a huge win.
With Cigna being the first commercial insurance to start covering it, can we assume that means maybe the other big players will follow suit?
I hope so. We saw something very similar when it came to balloon sinuplasty about a decade ago, right? Where initially a lot of the privates were considered experimental, and then with time, with mounting and growing evidence, slowly one by one, they all start covering it.
So in terms of patient presentation, how do patients with chronic rhinitis usually present to you?
Yeah, so chronic rhinitis, what it means is inflammation of the nose, right? So there's a few kind of cardinal symptoms for it, but it's really a pretty wide range of disease processes that all present with it. So the main symptoms that people get are chronic nasal blockage or congestion, chronic nasal drainage or discharge, itchiness, sneezing. Those all play into it, right? There's a lot of patients that I see that have this disease, especially because of my practice is I just see rhinology patients, so it's very focused in on that disease process. And so vast majority of the patients do have some component of chronic rhinitis. Even those with chronic sinusitis, a lot of times they have downstream rhinitis due to the chronic sinusitis.
Yeah, I would imagine in a practice like yours, it's every patient.
Pretty much.
Essentially, you're not having to screen for them among patients coming in with other complaints.
Yeah.
Especially in a rhinology practice, it's
let
me guess, you've got stuffy nose, runny nose. Yeah.
I know. I mean, every now and then we get an earwax patient, right? like every ENT, right?
You're like, what is this on my list today?
I'm impressed that earwax can make it into the rhinology practice. Good for you. Keep that
like
skill
a microscope.
Set up.
What is this microscope I have to use? I'll just give you the endoscope. We'll clean the wax out.
I do actually clean out waxes with the endoscope. Because I've already going to scope their nose because I already have nasal complaints. So if they come to me and they have some earwax, I just use a little camera, a little curette, and clean it out.
Yeah,
fun.
We got this.
That's awesome.
We got this.
Well, then you can record it, and people love watching earwax, getting removed. So
I've actually done that a few times because every now and then you randomly pick up things, right? So I found a couple middle ear masses or cholesteatomas, and I was like, I'll put a camera in there, I'll take a picture and send it to one of my otologists.
Yeah.
Huh.
That's awesome.
Endoscopic ears, it's a thing.
Yeah.
So back to our stuffy nose, runny nose patient. Can you talk to us about your history taking? Are there particular questions that you always ask? Is there important things that you kind of need to pick up on in the history?
Yeah, absolutely. So this is why I'm a huge fan of these patient reported outcome measures, the questionnaires. The big ones that we use are SNOT-22, total nasal symptom score, nose scores, right? Because essentially those questionnaires cover a lot of the questions I typically would ask. So things like nasal congestion, nasal drainage, discharge, postnasal drip, loss of smell, facial pressure or pain, all these kind of different questions are all on there, right? And so I have my patients fill them out in the preoperative area. And so when I'm walking into the door, going in to see them, I can take a quick glance at that questionnaire and I see a lot of the answers to all the questions I typically would ask. That allows me to start focusing in on the diagnosis a lot faster, asking more about frequency, duration, severity, and try to address their specific complaints. But yes, all those nasal complaints are all really important. So that way you can screen every single one of your patients.